And joining me now is Dr. Tom Inglesby. He's the director at the Center for Health Security of the Johns Hopkins Bloomberg School of Public Health. Dr. Inglesby, welcome to Meet the Press. And let me just start with a simple question. 33 states are doing this. We noted that 18 states have hit their one-day case total high of those 33 in the last 2 weeks. So technically not meeting those phase one metrics. Are we ready to be doing this as a country?
I think we need to be going forward very cautiously. I think if you look at the overall country numbers, we're about 200,000 new cases a week at this point. And in the last month, we've had something on the order of 60,000 deaths. So most of the illness and death has occurred over the last 30 days. So overall, as a country, we still have a long way to go. But the states are in very different places, and some states, a small minority of states, are beginning to get closer to the White House metrics of 2 weeks decline. And so in those places, if they have other capabilities in place, if they're able to really rapidly isolate and trace the contacts of patients with COVID, if they're able to diagnose very widely everybody who's got symptoms of COVID, not just the sick people, but everybody, then those states would be the places where it would be least risky to go ahead and begin to reopen.
Are we, do we not have the testing capacity right now to give the states the security they have of making these decisions? How much is this somewhat guesswork because of our lack of surveillance capabilities when it comes to where the virus is in many of these places?
Yeah, I think there still is a lot of uncertainty. But there is a range of diagnostic testing capability across the country, and you can tell that in the percent of persons who are positive. In some states, they're testing so many people that the percent of people who are positive is very low, and that's a good number. In other places, right, the percent of people testing is very high, and that's worrisome. So it depends on where you are in the country in terms of access to testing, the operations around testing. It's like a patchwork across the country.
Is there a way, when were you going to know whether this is a mistake or not? Is it basically waiting the next 2 to 4 weeks in these incubation periods?
Yeah, for this disease, it's going to take about 2 to 3 weeks for us to begin to see trends that come out of the changes in social distancing. So a measure taken this morning, you probably won't see a change in hospitalization rates or ICU capacity until 2 or 3 weeks from now. So that's the nature of the disease. It's going to take a little time for things to get into the system.
What is something that these state health officials don't have access to data-wise that you wish they did before making these decisions? I
think we should, in the coming weeks and months, we need to get a much better handle on the number of mild and moderate cases of disease that we have. The good news is that many people do not get seriously ill with this disease. But the bad news is that we're not capturing those people in terms of numbers for the country. And if we don't know who they are, then we can't break their chains of transmission. We can't isolate them. We can't quarantine their contacts. So we need to know much more about the mild and moderate illnesses around the country, and that will come with more diagnostic testing.
I want to ask you something that somebody wrote about the CDC. It was, I think, a colleague of yours at Johns Hopkins, or no, excuse me, Dr. Jahaz at Harvard. But it was sort of the odd lacking of missing data that the CDC normally tracks. He said, normally, if you wanted to find out how many people had tuberculosis in this country in the last year, ask the CDC. Want to know about health care associated infections? Ask the CDC. But ask how many COVID-19 tests have been done, and the CDC doesn't have an answer. Want a daily update on how many people are getting hospitalized for COVID-19? The CDC isn't tracking it. Want to know if social distancing is making a difference? The CDC doesn't know. What is going on here? Are we missing a huge component of our public health response?
I think we do need more data. Clearly, I certainly agree with the need for the data that Dr. Jha outlined there. I think that we're tracking this epidemic in a different way than we've tracked others. We haven't had this urgent need to understand hospitalizations on a day-to-day, week-to-week basis as we've had for some of the other things we've confronted before. And we need to get better as a country. We need to get our, like, if you look at state health department data right now, some states are not reporting their hospitalization data. We live in a federal system. If they're not reporting it at the state level, it's hard for CDC to get that data in real time. So I think we all need to collectively get better. Some states have more data available than others, but we should all be rising.
Let's get a realistic timeline. Next 3 months, next 6 months. A lot of people are concerned about the fall. How concerned are you? And is there any way of avoiding a bad fall outcome at this point without either advancements in a treatment or a vaccine?
Well, before we even get to the fall, I am worried that we will have small waves in various places around the country for the coming months. Hopefully we won't, but as we begin to ease social distancing in various places in the country, this virus is highly transmissible. Nothing has changed in the underlying dynamics of this virus. If we stop social distancing altogether tomorrow, we would recreate the conditions that existed in the country in February, March. So what we need to do is continue to our best possible effort, all the individual efforts we're making around social distancing, staying 6 feet apart, wearing masks when in public, avoiding large gatherings. But to the extent to which we're able to do that over the next couple of months will dictate how we do as states and as a country. Ultimately, in the fall, we have an additional challenge. We have influenza that will reappear. The flu season will start. And at that point, COVID will be mixed with flu and will both be contributing to hospitalizations and ICU beds. And so we're going to have two concurrent large public health challenges at the same time. So I am worried about the uptake in hospitalization rate and the more people needing intensive care in the fall. But I don't think people should think that there will be a lull, that just because the summer's coming, we're going to have a lull before the fall. It would be wonderful if that happens, but I don't think we should at all assume that at this point, given the nature of this virus.
And I'm going to leave it there because I think that's the single most important takeaway viewers need to have. Don't call it a lull. It is unlikely we're going to have a lull in the summer. Anyway, Dr. Inglesby from Johns Hopkins University, thanks for starting us off with your expertise on this. Much appreciated.
Thanks for having me, Chuck.
And joining me now are two state officials. Hello from Washington, I'm Chuck Todd, and thanks for checking out the Meet the Press channel on YouTube. Click on the button down here to subscribe and click over here to watch the latest interviews, highlights, and other digital exclusives.